Hello and thank you for joining us on this special edition of Invest Africa for one of the most important stories in African business. My name is Kukuletu Mfupi. Well, healthcare development has long been a matter of concern on the African continent. However, due to the continent's fast-paced economic growth, there is a huge increase in investment. It is estimated that sub-Saharan Africa's healthcare market will go up to around $35 billion by 2016. Now, this figure is set to increase even further in the years ahead. Well, joining me now in studio to discuss healthcare investment in Africa is Alex van den Heerve. He's the chair of Social Security at WITS, as well as Stavros Nicolaou. He's a senior executive for strategic trade at Aspen. And in our Abuja studios, we join now by Sven Byl. He's with KPMG, a partner there, as well as head of healthcare for Africa. Gentlemen, thank you so much for joining us. Welcome to all of you. I just want to get a clear picture, perhaps, of the current landscape, maybe the investment landscape when it comes to healthcare in South Africa. Alex, perhaps we could start with you.
Well, the healthcare expenditure, both in the public and private sectors, tend to sort of keep pace with GDP growth as a proportion. So if GDP is doubling over a period of time, so will health expenditure. What we would expect to see is that the very high rates of economic growth are going to result in both public and private sector level investment, and obviously public sector investments involve quite a lot of private sector purchases as well. So I think that we would be expecting to see a lot of change in the next 10 years, and we've already seen quite a lot in the last 10.
Stavros, you come more from the corporate perspective and maybe the drug producing side. What has changed in the last couple of years?
Well, I think firstly, and I'll relate this very much to Aspen's business, and Aspen has now become the largest player on the continent. So we're larger than the multinational pharmaceutical companies, so I can relate it directly to our business. I think clearly what's emerged is you're starting to see a middle class coming to the fore. So previously, Africa very heavily dependent on donations and donor funds, etc. They still exist, obviously, still exist in a big way. But you're starting to see now with some of the GDP growth we're seeing in Africa, Angola, Mozambique, Zambia, you're starting to see the emergence of a middle class. And that middle class is looking more and more at branded products. And they're starting to exercise choices as opposed to commodity type medicines that you would expect to receive from donor fund organizations. So for me, that's the fundamental shift that's happening. So your overall consumption in healthcare spend per GDP is growing on the continent. So I know that often difficult to get stats around private markets in Africa, etc. But previously in South Africa, it's well known we spend around 8.5%. I think Alex is more skilled at telling you the exact numbers. Around 8.5% of GDP is spent on healthcare in South Africa. If I look at the continent, it seems to have shifted from around 3.5%. It's probably closer to 5.5%. Those are the numbers that are being bandied around. I think, Alex, you might want to confirm those. But so that's happened over the last decade or so. So I think you are starting to see an increased expenditure in healthcare. You're starting to see an emerging middle class consumer that's starting to exercise private healthcare options.
Sven, I'd like to get your insights on this. This new increase in healthcare expenditure, surely it does present an investment opportunity.
Yeah, well, as Alex clearly articulates, there's a connection between GDP spend and obviously spend on healthcare. I mean, I'm just hot off a 3-day conference in Nigeria at the Presidential Summit on Universal Healthcare. And that was hosted by the president here with an explicit goal that by 2020, 30% of Nigerians will have universal healthcare cover. That's an ambitious goal for this country. I've no doubt that they will achieve it. They are absolutely dedicated themselves to achieving that through a universal declaration that they announced yesterday. And so once you have a middle class who has prepaid health insurance, you then have sorted out one of the payment bungling blocks. Then there's a question about how does supply organize itself? And supply can much better organize itself once it knows that it has a population that has prepaid insurance. And that's what we're beginning to see now on the investment side. So today's conference where I spoke this morning was along with our friends from the IFC to begin to think about how the private sector becomes involved in public-private partnerships. And there's a whole host of them that we see here today. We're working with investors who are building private hospitals. We're working with new chains who are coming up. There are some existing players who are rapidly expanding. There's some new innovations, some step-down facilities, as well as some rapid diagnostic centers, some urgent care centers, some of the things that you don't see in other parts of the continent that are coming in here. And Nigerians are incredibly skilled at being able to now deliver that. And that's all possible. That investment climate is all now possible as there's clarity about how the demand side will organize themselves from a payment function, and that's why universal care is so important.
Alex, I want to get your views on this. So you've definitely done a lot of research regarding public-private partnerships. In South Africa, the NHI in itself is taking a while to come on board. Are there countries that are doing it correctly on the continent?
Well, first to distinguish between what would be universal healthcare strategies from public-private partnerships. Essentially universal health coverage involves strategies to get people into some form of pooled or protected coverage, so that somebody is funding their healthcare on their behalf in the case of a general tax funded system, or that people are contributing to some form of insurance which is providing them with access to decent cover on a fair basis. Now, those kinds of structures themselves, the actual development of universal health coverage strategies, can involve structural public-private relationships in the way that you regulate the whole system. It's an option that South Africa is not really taking full advantage of at the moment. So
why is that? Do we know what the delays are there?
Well, national health insurance is actually not necessarily a coherent public-private partnership strategy, because it assumes that there's going to be one purchaser of a universal package for everybody. That's very different from systems which try to get multiple mechanisms to achieve the same objective. So then you've got private funders, and not just a public funder, performing public achieving social objectives. Now, that's what happens in public-private partnerships. You're trying to create some form of engineered structure that gets private players using what they do best to operate within a framework that is developed in which they actually then provide healthcare in a fair and accessible way. Private markets on their own don't always provide healthcare coverage in a fair and accessible way, but they don't on their own. But you provide a framework and they can. So everything depends on the structural framework you create, and that's where universal health coverage strategies can be very important in creating incentives for cooperation at the provider level, and cooperation at the funder level, as well as different forms of contracts and arrangements. In terms of specific public-private partnerships that develop when, for instance, a public funder wants to access private providers, which is part of what's proposed in a sort of very unclear way in the national health insurance proposals. Its purpose is to try and create what's often referred to as a purchaser-provider split, in which the public sector is not only used to fund public facilities, but can also buy private services. But for that to happen, public sectors have to invest in the development of contracting platforms. They must be able to efficiently procure services from both. And in many public systems around the world, and particularly in Africa, and very much so in South Africa, the public services have a difficulty. They have not created the platform that can talk to two sectors. It can talk to one, and it's not even getting its own contract with its own services designed very well. We will be in a better position than a lot of the other countries in Africa to deal with this problem, but we haven't dealt with it efficiently and effectively yet.
Sven, I want to come to you. Does this go back down to regulation and that platform that Alex was discussing?
In Nigeria, it's very interesting. They've created the NHIS, which is the body that will commission both public and private in order to deliver care. And they've chosen a very different strategies from some other countries in that they will work with for-profit administrators and health insurers to begin to think about how they deliver care to those that are most vulnerable. So in Unu State, for example, they've scaled up very successfully between the NHIS and Hygia, which is both a provider and an insurance company, the first 60,000 of vulnerable citizens who now have health care cover. And they've done that through a collaboration with Farm Access, which is a Dutch NGO. What's essentially happened is that over time, as the subsidy from the Dutch NGO was reduced, it took more and more of the payment over in its state budget. And now they will scale from 60,000 to 600,000 citizens over the next 2 years, providing full universal cover for that state. So it's an example about how they're able to, once they've created the contracting platforms and the payment mechanisms and the mechanisms in order to manage and sign up populations, that they now transfer that responsibility to a state. And what's happened in response is smaller practitioners have invested in clinics. A new infrastructure fund has been set up, the Medical Credit Fund, which provides very small loans, anywhere from 10,000 to up to 500,000 US dollars to pharmacies, to clinics, to urgent care centers that have now sprung up to service this population that has cover. And so that's how you can begin to see the building blocks of a private-public collaboration come together and provide cover for citizens.
Well, the medical aid cover is what we need, and then surely after that you need the medication from a company like Aspen. What opportunity does this provide for you? Because I take it you automatically, at the moment, serve both the public as well as the private sector.
No, we do, and in fact in Africa there are 3 very distinct markets. There's a donor market, there's a public sector market which is funded by the government, so usually tender-based in our instance. So things get, drugs and other equipment gets purchased through a tender-based system. And then you've got the emerging private market that I spoke about earlier. And within that private market, there's a self-medication market and then a more formalized market like we have in South Africa. So those are the 3 distinct segments. And obviously, if if you're looking to bolster, in this instance, the public sector and the private market, then naturally that's good for businesses such as ours. And I think probably reflects in the growth we had. We announced our results
recently,
last Thursday, I think it was last week sometime. And Sub-Saharan Africa, which incidentally excludes South Africa for our purposes, just for reporting wise, we exclude South Africa from the way we report Sub-Saharan. Sub-Saharan grew around 41% revenue terms for Aspen. So I think those opportunities are there. They offer small base, granted, but if you start aggregating the markets in Africa, then they start looking attractive. But we need to accept Africa's not a single homogeneous market, very heterogeneous, and within each country, the continent, you get the diversity that you see in any other market. So it would be a mistake to treat it as one single market and say, well, this is happening in Nigeria, so it's been replicated throughout. That's not necessarily the case.
Exactly. Well, we do have to go to a short ad break now and say goodbye to 2 of our guests. Sven Byl, he's with KPMG. He's a partner there as well as head of healthcare for Africa. More on healthcare investment right after this. And we also say goodbye to Alex van den Heerwe. He is an independent health economist, but also chair of social security under Wits University. Don't go anywhere. Welcome back to Invest Africa. Remember, we value your suggestions and feedback, so please send us your email to investafrica@abn360.com or interact with us on Twitter through @CNBC Africa using the hashtag InvestAfrica. Well, we are continuing our discussion regarding healthcare investment on the continent, and still with my guest, Stavros Nicolaou. He's a senior executive for strategic trade at Aspen, and we're now joined by Roelof Assis. He's the general manager at Philips in East Africa, joining us from our Nairobi studio. And Roelof, perhaps we should get a picture from you. We've taken a look at the environment regarding Sub-Saharan Africa as well as West Africa. But when it comes to the eastern part of the continent, have things changed regarding healthcare investment?
From the East African perspective, I think things have changed indeed drastically. If you look at both the public and the private sector, especially the private sector has picked up dramatically by increasing the investments, especially by where actually the government is lacking in delivering some of the services. especially in the field of non-communicable diseases like cancer care, cardiovascular diseases, and other diseases like dialysis, etc. So you see that the private sector is really doing a lot of things over there, but also the public sector is really stepping up its efforts to really meet, for example, first of all, the MDGs 4 and 5, which is in many countries still a big issue. And there you see many countries actually focusing a lot in adding additional investments and providing solutions to the grant, but also affordable solutions to the public at large.
I want to come to Stavros for that, because as Aspen you do have operations in East Africa, and the government is also appearing to play a role there. How important has that been regarding your expansion projects in East Africa?
Well, I think firstly we have operations which include factories, incidentally, in East Africa. So we're based in Tanzania. We've got a manufacturing facility there. We're in Kenya, we're in Uganda, and we also service the neighbouring territories, the Rwandas, Burundi, etc., from East Africa. So I think our experience is a pretty broad one, and it's been one where we're starting to see a transition again in the market, where there is more of a private sector starting to come to the fore. You're starting to see consumers exercising, as I said earlier, greater choice around brand selection. So things like brand equity and having trust and brand reputation are becoming increasingly important. Whereas the market previously was quite dependent on donor funding and commodity products. So still a lot of commodity products in East Africa, but you're starting to see that segregation into a different type of market segment where there is private sector growth and that establishment of that middle class in Africa.
Roelof, we just heard Stavros mentioning the role of the private sector in healthcare, and so often when we hear about the private sector in healthcare opportunities, we think of high as well as exorbitant costs. Is this the case when it comes to a market like Kenya?
Actually, what you see at the moment here in Kenya is that the private sector is representing approximately 50% of the total market. So they are a very important part of the total healthcare delivery system, not only to Kenya, but I think to East Africa. And as such, they really play an important part, yes.
And what about the role of innovation? You know, so often we hear that South Africa is a continent, or Africa rather, is a continent lacking in innovation. Are we seeing enough innovation regarding healthcare?
I think so. If you look, for example, at Philips, which is really an innovation company, to really be relevant and also to make sure that we are providing the right solutions to our customers. Philips is one of those innovation companies, I think the innovating companies, to provide solutions to the healthcare sector, which are really different than what is actually out there in, for example, the Western world. Look, for example, the potential of using mobile phone technology, whereby instead of using the personnel and resources to go out in very remote areas, we can use technology like the remote areas with mobile phone technology to bring actually imaging and data from the remote areas to center areas, thereby providing solutions which are otherwise difficult to tackle. So innovation is key, I think, when it comes to Africa, and Philips is one of those innovation companies who provides real innovation solutions to Africa.
Well, Stavros, maybe we could touch on the point of innovation. Now, you work within the pharmaceuticals industry, where surely we need to find some kind of African solutions to African problems.
So I think firstly, let me say that pharmaceutical innovation on the continent has been more akin to formulation and development rather than traditional R&D, research and development. And I think that's worked well on the continent because, for example, Aspen pioneered the development of generic antiretrovirals. So the first generic antiretroviral sold on the African continent came from an African producer. So I think that was quite a milestone. I think associated to that milestone was that we were also the first company in the world to receive US FDA approval for the manufacturing of a generic antiretroviral, which is a product called Stavudine. This was over a decade ago, but it was quite a milestone at the time. So I think when people say, well, do you really innovate, or are you innovation driven on the continent? I think in our own way, yes we are. But I think we're also realistic around what we can do and what type of innovation we can pursue.
Why not? Does that come from a lack of a skills base, perhaps, with people who are studied far enough to be able to become more innovative when it comes to drug producing?
I think it's multiple factors. I think firstly, the investment needed to innovate a new compound is exorbitant. It's anywhere between $2 and $2.5 billion at last count. So significant investment needs to go into that. So aside from the skills base that you require, it's the type of investment you need. So I think where we've made progress is around areas like biodiversity. You know, we're looking at an HIV vaccine on the continent. So those type of areas where we've got the extent of the pandemic requires you to become involved in research. That's very much where we're channeling our research on the continent. And as a consequence of that, we're starting to retain some scientists on the continent. You know, previously, turn the clock back 10 years, 20 years ago, if you were a scientist with any aspiration, you would leave. You'd go to Europe, North America, Japan perhaps, mainly North America and Europe. You're starting to see some type of retention now of scientists on the continent, which is a good thing, augurs well for the future.
Tell us about the future, in particular maybe from Aspen's perspective. I take it Africa is the growth story for the company going forward?
Well, I think there are a number of growth spots for Aspen. I mean, Asia Pacific is certainly the most important one. You know, that's where you're going to see real accelerated growth. Latin America is important, but in equal measure, Sub-Saharan Africa remains important destination for us. It's a destination right on our doorstep, and it's one that we've seized the opportunity in. And I think if you look at the growth projections in terms of healthcare spend on the continent, you know, the pharmaceutical market on the continent is estimated to be, and this includes the Maghreb territories, incidentally, the North African territories, estimated to be in the vicinity of around $9 billion. But that will double in the next decade. So certainly some healthy growth patterns, and growth patterns that I think Aspen will look to in future.
Roelof, Stavros a moment ago just touched on the skills base, and we're managing to retain some scientists that 10 years ago would have definitely left the continent for better opportunities elsewhere. Are we seeing this taking place in your particular sphere?
Yeah, what you see at the moment is a very interesting trend. Indeed, 10 years ago, a lot of doctors and specialists left the country to find greener pastures somewhere else, or to find healthcare providers which can provide the services. But now you see actually a lot of doctor specialists coming back to East Africa and putting their expertise back again to the East African community, and of course to all the patients over here. Which is an effect of both the private sector as well as the public sector, investing in healthcare facilities, in investing in equipment, to really make sure that also those professionals who come back can have an environment where they can provide professional and quality care.
To get a picture of the future when it comes to the healthcare sector on the East African continent, what should we expect in the next 10 years?
I think Africa possesses a potential for great growth. I think in the 10 years time from now, you really see a complete different healthcare perspective than what you see right now. Look at all the innovations, what we saw in the IT sector, in mobile phone technology. The same kind of real breakthrough innovations will happen into the healthcare sector as well. And I think that really will see a dramatic change. What you currently see, for example, in the field of health insurance, currently only a very low percentage is insured. I think if we make use of very innovative solutions, a large piece of the population can be insured, thereby providing healthcare to all. And I think that I see also happening in the next 10 years.
Thank you so much to my guests who have joined us today. We've come to the end of this week's episode of Invest Africa, but thank you so much to all of our guests. Bruce Whitfield is up next as he unpacks the latest news from South Africa's economy on Tonight with Bruce. Until next time, it's goodbye from myself and the team, and thank you for joining us.